Okay, I'm talking with Mr. Arthur Gasch, who is the owner of the Medical Strategic Planning publishing house. And Arthur, I guess my first question is, why did you start Medical Strategic Planning in the first place?
Well, I was responsible for market research for all of Siemens Corporation's electromedical divisions worldwide, and I was having great difficulty in finding accurate and outstanding market research from organizations like Frost & Sullivan and other companies that were selling market research reports. And I decided that it would be easier to go out and create a company to develop this kind of market research than it would be to try and sort through the choices we had that were already currently on the market.
Yeah, because you've become over the years, I would say, the leading publisher of what I would call analytical content for American healthcare. And was that a sort of a deliberate choice, or did you find that by accident?
No, from the beginning, it was our objective to base the market research from the ground up. All of the other companies that we had that were available in the U.S. market would take this information from the top down. They would start out with what the expected revenues had been for a particular segment of the industry and carve it down then by the companies, and then try and carve it down into market segments like hospital, and to carve it down further into clinical areas. And there were so many assumptions and unknown pieces of information in that process that by the time they got to the second or third level down, where the data was actually granular enough to be actionable by clients, their data was just terribly skewed. So our approach was exactly the opposite. We would go out to the market, survey American hospitals, for example, for products sold there, hospital by hospital, get 75 to 80%
in EHR's electronic health records and their relevance, which I think is timely. How did that come about?
Well, actually, it goes way beyond Siemens. I started in this industry in the early 1970s. And my first career job was with the medical group at Hewlett-Packard.
Oh, right.
And Hewlett-Packard in the early 70s was the only major company that had a lot of electronic health information systems. They had systems for patient monitoring in intensive care units, electrocardiology analysis, cath labs, etc. And so I was at the time marketing those systems. And the very first seminar I ever did on electronic health or information-based systems was one that we developed for Hewlett-Packard back in 1975. It came about because we had had a very successful track record of selling these systems, but we're finding that the lead time to close an order was 12, 13 months. In order to cut that down, we started to do educational seminars on electronic health record systems and other electronic systems Hewlett-Packard made, and invited customers to come and learn all together at one time rather than selling them sales cycle after sales appointment after sales appointment. We were able to close a year's worth of business 3 months after we did the first seminar back in 1976. Subsequently, all of the large patient monitoring companies decided that clinical information systems would be differentiators for them from the smaller companies who weren't able to launch clinical information systems. So they began to make partnerships or acquire things or spin off their own divisions to do information systems for hospitals in the acute care setting. There were informations for ICUs, for the operating room, for the perioperative record, for the perinatal unit for women who were delivering, for the emergency department. These were all key areas where clinical information systems were required, and various vendors started in the inpatient side to do that. The development of electronic health records for the physician office and alternate care sites and clinics came subsequently in the 80s and the 90s. But we were aware of that and tracked it nonetheless, because many of those doctors' offices were also buyers of blood pressure monitors and electrocardiograph machines, other devices that had information systems associated with them.
Okay, but were the hospitals aware of it? Because if we fast forward to today at 2010, quite a low percentage of American hospitals have
we're talking about
electronic health
products,
records.
but that what readers were really interested in were solutions to problems. And the vendor either didn't talk about the solution to the problem or talked about it in the very narrow framework of their product solution. So an industry alert, since it was a subscription based and we weren't dependent upon vendor advertising as a financial source for publishing it, what we decided to do is take a problem. How do I pass information around the hospital from all of the different systems? Look at 2 or 3 or 4 proposed solutions that were commercially available in the market, or maybe one emerging solution that was not available but seemed to solve and address the problem, and discussed that, and then drilled it down into maybe a particular vendor or two that adopted that particular approach. So we became the champions in industry alert of the companies with emerging technologies.
Right.
There may be the smaller companies that that weren't being opposed, because they were always being opposed by the larger companies
Sure.
that had the installed base that were trying to hold on to market share.
So we became regarding the future of American healthcare, given the amount of millions of dollars that apparently are being put into meaningful use applications.
I guess I would say I am a pragmatic agnostic about it. There's certainly a lot of money being spent. Whether it's being properly spent, whether we have learned the lessons that other countries in Europe
Yes.
who have been addressed these problems previous to us have learned, I doubt. Several American EHR companies went out of business trying to do the automation project in the UK, for example.
Yeah,
so
true.
IDX no longer exists.
Yes.
It's part of GE, and that's true of others that were participating in that. And whether we have learned as a country those lessons, I don't know. We're clearly making a dramatic shift towards a more socialized, government-controlled, government-funded approach to healthcare. However, the background for that switch is quite different than it was in any of the European countries at the time they made their switch, and so we're probably going to go through more perturbations and growing pains, and we may not be making the best investment of our technology dollar at the present time the way we're going. On the other hand, there's a great deal of concern and discontent about that in the United States and their upcoming federal elections, and if the Republicans displace a significant number of Democrats who have passed this legislation, there's likely to be a major turn in policy again. So it's really quite difficult to read the tea leaves over here. It has to do with which party's in power and which party's coming in power. At this point in time, the Obama's popularity ratings in the United States are in the 30% rate, but Congress is in the 20% rate. So people are very angry in this.
So he's doing something right.
Yeah, well,
by comparison.
he's doing better than the Congress is doing, and they passed all this stuff. So we'll see how it goes.
Like
but it is encouraging that we're trying to base a more standardized approach in medicine
Sure.
that is decision-based on best practices. And in order to do that, the electronic health record is a core fundamental technology that must be in place in order to manage that kind of a medical care delivery system. And that's why there's this large push for electronic health record systems. And that's why by the way, the adoption of those in hospitals is only 8% 3 years ago. And that means 8% of the hospitals had what you'd call an integrated information system that was enterprise-wide. There were many hospitals that had a unit here, an EHR there, but none, again, were integrated information systems. That's being mandated to change, as it is in the physician office, and the connectivity between the alternate care provider, physician, immediate care center, skilled nursing facility is now being mandated with the hospital, and we're beginning to look at the transitions of care and planning for transitions of care out of one care setting into another, and that broadens, of course, what we're writing about in the Industry Alert magazine.
Arthur, it's been a pleasure talking to you. Thank you very much for this interview.
My pleasure.